The Women of Achievement is an award based on not what you do from 9 to 5, but what you choose to do on your own time as a volunteer. It's been an honor, and I'm incredibly humbled to have been recognized as a Woman of Achievement. These women are amazing. With their passion and their expertise in their field, you really feel blessed by the environment, the sisterhood that you're now a part of. And I'm so thankful to Washington University and Siteman Cancer Center and BJC for supporting this outreach and this work, because many times it has to be done in the middle of the day. The most rewarding part of being a physician is first taking what is a very difficult journey, as I call it, the wingman. I'm part of your team, you lead the team, but I'm giving you directions. You take as much of it as you want, but it is my job to educate you as much as I can about this disease so you can make an educated decision. But I'm here to provide hope, but also to give you a treatment plan. And at the end of that 5 or 10 years, when I can say you don't have to see me anymore, there's nothing better.
People seek her as their physician. It's because of the reputation that people have provided, that she's always been positive about treating an individual. She's been inspirational. She provides the care that people look for. She was always out in the community attending churches or events, and to give up her own personal time.
I met Dewey over 10 years ago. He was a new patient in my clinic with a new diagnosis of prostate cancer. He's a veteran. He is a professional. He came with his pages of questions. And how were we going to get through this? 10 years later, it brought a tear to my eye to have to release him out of my clinic, but I am so pleased that he was free of disease. At the end of his treatment program, I said, he would be an excellent spokesperson.
Early on, Dr. Hall asked if I would be interested in joining a group that she was in PCAD, Program for Elimination of Cancer Disparities, and be an advocate and speaking to men and talking to men about early diagnosis, testing, and treatment on prostate cancer. And seeing her passion, I decided that I would become an advocate, talk to other men about prostate cancer.
The more that we're willing to tell our stories, to talk about what has happened to us, we make what is a fearful topic approachable. Really allows you to feel comfortable about saying, I should probably go to the doctor. It's not about just us. It's about how do we keep our families, our neighborhoods, our communities, our churches healthy, and we're all in this together.
Just by meeting her and watching her work attitude and her interest in me as an individual, it inspires me to continue to be an advocate.
We have amazing community cancer advocacy groups, events, and we always need volunteers to help. So even helping at Siteman Cancer Center and some of our outreach activities, or working with some of the community cancer advocacy groups, we need you.